Hello everyone, my name is June from Improve Africa, or IMA, the project coordinator, and also handle the business development and grants. Improve Africa is an organization that is registered and operates in Kajiado West, and we have 5 thematic areas. We have education, we have gender equity, we have economic empowerment, which is actually the backbone of this organization. We also have environment and climate change, and the last one, the water, sanitation and hygiene. For the past 6 months, we've had a program that we've been running called Chakula ni Dawa Initiative. It's an initiative that was funded or granted or done a partnership with TICA. And we've done quite a number of things in our areas of operation, that is Ewaso ward in Kajiado West. We've done training of 17 management and village agents staff. We've also done a clustering in Ewaso, where we have 12 clusters, and each cluster has a village agent and its own managers. The reason why we've done the clustering is because we need to get into our communities and also reach to the needy. The Chakula ni Dawa initiative is an initiative that has really been accepted well by the community, and also we've done a great collaboration with the stakeholders, especially the government. So we've worked with both the state and the non-state institutions, and we've also seen so many things happening in the ground. The Chakula ni Dawa initiative covers 80% of HIV programs. Then we have the 10% of OVCs, and that's the orphan and vulnerable children. We also have the people with disabilities, covering the 10%. So what we've already witnessed throughout the program is the willingness to embrace change by the community, because we've seen people or the community actually buying the idea of healthy foods, also seeking treatment. Also the attitude toward the healthy foods. For a very long time, we've noticed that our people or our communities don't embrace healthy foods. We've also seen the community ownership and absorption of the program. We've seen the sustainable practices happening in the ground. We've also seen the strengthened partnership and collaboration with the Ministry of Health, the Ministry of Interior. We also have the village agent groups of the VSLA groups that we have on the ground. We've also seen a very great collaboration by the Ewaso Health Center. We've seen everybody coming out to actually embrace this. During the 6 months of this program, we've done quite a number of activities. We've done the inception meeting, which was very key, especially bringing everybody on board, the Ministry of Health, the Ministry of Interior, the VSLA groups, and all the stuff that we have on the ground. So we've also done the demo farm, which is actually in Kibiko. The demo farm was supposed to be done in Ewaso, though Ewaso is actually where we got the grounds. That's the health facilities in Ewaso ward, or in Ewaso shopping center. It's actually a corridor for the wild animals. It's a corridor for the elephants. So it was quite tricky for us to carry out a demo farm at Ewaso. So we opted to do it in Kibiko, one of our clusters. We also have the inception with the health stakeholders, which was very key, because this program is actually mostly about HIV and OVCs and all that partakes health. So it was important that we bring and also train the health staff.
I'm Dixon Salo. I coordinate community health services at Ewaso and Nigeria and Olbumi. The project is beneficial to the community because I remember the last time that we had a sensitization meeting here at Ewaso. There is a group that we sensitize on how to do these small gardens for them to improve their nutritional status. So we have seen a change in diet. People have started improving on nutritional status. So we have seen it has a good impact to the community. So these messages will reach the community easily, because also we have CHPs who visit households, so they give also messages there at the households. I recommend we continue doing collaboration with the Improve Africa. Also, we are requesting, if it's possible, we do more sensitization to the community through the CHPs. We do trainings for the CHPs for them to get that capability of doing those sensitization there at the community.
Okay, my name is Daniel Mokaya. I'm a clinical officer in Waso Health Center. Welcome. From the start, since you came in and cooperation with us, I will talk about HIV nutrition and more so how we have improved home deliveries since the last training we had. So nowadays, actually, many of our community members are not afraid of HIV testing services. We have improved. Every month we are seeing there is an impact. Second, I will talk about nutrition. We have seen a reduction in cases of malnutrition in our community since we started cooperating with you. And now at least we can have many of our clients coming to our facility to seek for nutritional advices, and we have minimized all malnutrition cases.
We've also done the community outreach and nutrition screening, which was very interesting, seeing everybody coming on board, and especially the community.
Kwa majina naitwa Magdalene Risho. Nimeshukuru kwa hii kampuni inaitwa Ima. Alitusaidia sana. Tulijua machakula yenye tunakula. Tulikuwa tunakula ugali na maziwa. Sasa tuna change chakula. Tunakula mboga na ugali. Tuna change mboga yote, chakula yote, matunda. Tunakula vizuri. Tulipata afya mzuri. Sasa tuko afya mzuri. Tulifundisha HIV. Tulifundisha venye tunaendelea, venye tunafanya ndio tusipate. Tulifundishwa ndio tukunye dawa PrEP na PEP.
Hello watu wangu, mimi ni mkazi wa huku Waso. Kwa majina naitwa Daniel Ngobolo. Tumesaidiwa na Ima. Tumepata training. In the past 3 months we have been in a training na tulisaidiwa sana. Kwa njia ya kiafya, ubora wa kukula chakula mzuri, kusaidia watu ambao wajiwezi pale.
Peter Laon from Waso residence. I'm a TOT from Improve Africa. We have been in training for 3 months. We have been training about HIV. I recommend Ima that it has done a very good job to our community, to help the community to know their status, and I recommend that we train others that they don't have access to trainings, so we go house to house, we train them in churches, in schools, we create awareness.
This was conducted in a Waso shopping center where we had to bring on board the health team as well from the health facility, and also the Ministry of Health giving us a go-ahead to actually carry out the screening. So this was done so that we can actually reach out to the people who are living with HIV, people with disabilities, and also the OVCs, and also bring everybody on board to feel accepted. So it was very key that we carry out this screening, because without us knowing about our status becomes a big challenge, because people will not be able to access the health care that is needed. Just before the screening was done, we had to do a collaboration again with the social media and also and especially the Paran FM station, radio station, which is the local station. We had to speak to our people about the HIV, tree planting, and eating healthy. And throughout the show, we were actually surprised by the number of people who called, inquiring about HIV services and also how they can actually do the kitchen gardens, which is very interesting, because that's quite unusual for people to come out to speak about HIV, especially on air. And we've also done a collaboration with Empiris TV, which did actually the ground coverage, so that we can reach out to our people and also know how many people we've been able to reach out to. Throughout that program, we've seen actually people coming out, because those two stations, Paran FM and Empiris TV, are stations that the local people are able to access. However, this does not go without any challenges, and throughout the program, the 6 months program, we've come across quite a number of challenges, and this is inevitable. We've had the human-wildlife conflict. So it makes it a bit difficult for our community people to actually do the demo farms, the kitchen gardens, though that can be also avoided if a lasting solution is actually reached. So we look forward to actually having these kitchen gardens happening in Ewaso. We also have the issues of stigmatization is still there. As much as we talk about HIV openly right now, we still have people who are a bit taking time to actually seek medical health care because they're afraid of stigmatization, either personal or also from within, also from outside. So we have issues of early marriages. We still have a few cases of FGM, especially in some parts of Ewaso. Those are cases and issues that we are really trying to work hard and also partner with our different institutions so we can see these practices eliminated. And also the vastness of the area of operation. We have some areas that are very hard to access. Plans for the next 3 months, however, we need to do a project follow-up. So after all these trainings have been done, the demo farms and also the collaboration with the stakeholders, we need to do the project follow-up, making sure that all our clusters have received the trainings, the necessary trainings, and all the projects that we've actualized, especially the demo farm, is actually duplicated in all our clusters. The second thing that we need to do is actually monitor the demo farm and other projects. So we need to do a close monitoring of the demo farm to make sure that the herbs that have been planted, the trees, the fruits, the vegetables are actually taken care of so that we have continuity and sustainability, and especially when it comes to the food basket. And probably the last but not least, we also have the cluster trainings. We need to continue doing these trainings because health is quite wide, and we need to have these trainings across all our health facilities and also in all our clusters. And eventually we'll actually have all the trainings and all this information out there in all our counties. Finally, we need to thank TICA for actually choosing IMA, Improve Africa, as a partner, and also for this exciting and yet educative program. So we are really grateful to TICA. However, we have a recommendation. We seek further collaboration going forward in 2025, so we can have all these activities duplicated across other areas. And the last thing is actually have further trainings and more learning and reflection meetings so we can all learn from each other. Thank you.